Hi, my name is Brandon Campbell, and I have Miss Catherine here today who has volunteered to do our head-to-toe assessment with. Prior to doing the exam, we were able to get a full set of vital signs on her, also including her height and weight. We also used a Snellen chart to check her optic nerve, cranial nerve 2, noted that she was 20/20 in each eye, does not use any correction aids. I was also able to watch her and her gait as she walked. It was smooth and symmetric, no abnormalities were noted. Thank you for being here, Miss Catherine. Is anything bothering you today?
No.
Okay. Well, we're going to go ahead and proceed with our exam. What I'd like to do when we start, I would also note that we also asked her, she was able to tell us her name, her date of birth, where she was, what was going on, what year, so we know that she is awake, alert, and oriented to person, place, time, and situation. So go ahead and start the exam. First, I'm going to go ahead and inspect your head. Looking at the top of your scalp, I'm noticing your hair distribution, noting that it's coarse, you're not missing any hair. Everything looks pretty symmetric on each side. I'm going to go ahead and palpate, noticing for any dentations, any lumps, or any masses that shouldn't be there. Everything's normal. Okay, you can go ahead and look at me. I'm going to go ahead and inspect your face, looking for symmetry, checking your eyes, the septum of your nose, your mouth, checking your ears, noticing the contour, also looking for any lesions or any scars, any lumps. Don't see any of that. So what I'm going to go ahead and palpate your sinuses, your frontal, maxillary, any pressure? Okay, we're going to go ahead and palpate your lymph nodes. We have your preauricular, posterior auricular, occipital, tonsillar, submandibular, submental. We can feel your cervical lymph nodes and supraclavicular. Don't feel them. That is a normal finding. Next, since we've already inspected there and we've already palpated, we're going to go ahead and go on to the eye portion of our exam. Since we've already tested cranial nerve 2, we're going to test cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens. Sorry. Just go ahead and follow this top of the pen. Don't move your head, just your eyes. Good. Good. We test for convergence. Good. That lets us know that 3, 4, and 6 are intact. We're going to go ahead and check pupillary response. Checking direct. Good. Now we're going to check consensual. Good. It's intact. Next, we're going to go ahead and check your peripheral vision. I'm going to wiggle my fingers. Let me know whenever you can see them.
Okay. Okay.
Good. It's intact. Next, we're going to go ahead with the ophthalmoscope. We're going to go ahead and look into your eye. With my right hand, I'm going to look into your right eye, looking at the optic disc, the optic nerve, making sure we don't see any cotton wool bodies or any abnormalities we would see when we look into the eye. Just go ahead and look straight ahead forward for me. Good. Good. Red reflex present on each eye. Now that we've done that, we're going to go ahead, we're going to move from your eyes. We're going to go ahead and go down to your nose. We're looking, again, we said the septum, it's not deviated, it's midline. Go ahead and lean back for me. I'm going to look into each nair, looking for any polyps, checking the mucosa, making sure we see patency. Everything appears normal there. What we can do is we can also check for patency. I'd like you to press one side of your nose and breathe. Fine. Do the same thing with the other, please. Any problems?
No.
Good. We'll go ahead and get you to close your eyes. Tell me what you smell.
Alcohol.
Good. That lets us know that cranial nerve 1, olfactory, is intact. Moving on, what we're going to do is we're going to go ahead and check. We're going to go on and move to your ears. Something that we call the Weber test. I'm going to strike this tuning fork. I'm going to place it on the top. Let me know if you hear it in one ear or the other, or if you hear it in both.
Both.
Good. Now what we're going to do is I'm going to strike it again. Let me know when you no longer hear it. This is the Ren test. I'm going to place it on your mastoid bone.
Okay.
Good. That lets us know that air conduction is greater than bone conduction, which is a normal finding. And again, we would do that test in the other ear to elicit those findings in that ear as well. Now what I'm going to do is with the otoscope, I'm going to go ahead and look into your ear. Pull the peanut up and back, down and forward, look into the ear, noticing that there's minimal earwax, there's no redness in the canal. The tympanic membrane is pearly gray with a cone of light of 5 o'clock, which is a normal finding. And again, we would do the same thing in the other ear so that we can elicit those findings as well. Now what I'd like to do is, I'd like to go ahead and test for cranial nerve 7. Can you smile for me? Can you frown? Can you puff out your cheek? Can you raise your eyebrows? Close your eyes real tight? Good. That lets us know that the facial nerve is intact. Now also what I'd like you to do is, can you clench your jaw for me? Open your jaw. Move it side to side. Okay. That lets us know that the motor for cranial nerve 5, the trigeminal nerve, is intact. And we're going to go ahead and check the sensory portion of that nerve. I'd like you to close your eyes. Let me know if you feel something sharp or soft.
Soft.
Good.
Soft. Soft.
Good.
Sharp. Sharp. Sharp.
Good. That lets us know that the sensory portion of that cranial nerve 5 is intact. Now we're going to go ahead and move down to the mouth. What I'd like you to do is open up for me. Stick out your tongue. Good. I'm checking your teeth. I'm looking for any dental caries. I'm checking your gums, seeing that the mucosa is nice and pink. Checking your tonsils, looking for any swelling, any redness. Looking at your uvula. It is midline. Checking your soft palate, your hard palate. Good. Can you stick your tongue out one more time for me? Can you move it side to side? Okay. The tongue is letting us know that cranial nerve 12, the hypoglossal, is intact. Can you swallow? Good. Any problems with that?
No.
Good. By doing those two tests right there, we know that cranial nerve 9, the glossopharyngeal, and 10, the vagus, are also all intact. Now that we've done that, we're going to go ahead and we are going to move down. We get you to kind of face forward up a little bit for me. Kind of turn towards the camera for me if you don't mind. I'm going to go ahead and kind of feel. I'm going to feel for your thyroid right here. Can you go ahead and swallow for me? Good. Any problems there?
No.
Okay, I'm going to just kind of push your trachea off to one side. I'm going to feel. No problems there. Push it to this side. Feel. No problems there. Good. You can go ahead and sit back straight for me, please. What I want you to do is go ahead and shrug your shoulders. Good. Turn against my hand. Turn against my hand. Good. Can you turn your head all the way to each side? Can you lay your head down on your shoulders? Good. That lets us know that cranial nerve 11, the spinal accessory, is intact. Now that we've done that, what I would also like you to do is we're going to go ahead and move forward. I brought my stethoscope. I'm going to use this in just a second. As I move down to your chest area, what I want to look for is I'm noticing that you're breathing. I'm looking to see if it's symmetric. I'm going to go ahead and look at your chest area. I would look to see if I notice any lumps, any masses, anything that is abnormal. Then I would go ahead and I would palpate, checking for any abnormalities. None. Then I would go ahead and I can percuss, listening for resonant sounds that we should hear all throughout the lung. Good. Then what I can do is I can check for tactile fremitus to see if I can feel the vibration, if it's even as we're going down through the respiratory. Say 99 for me.
99. 99. 99. 99.
Good. Now I'm going to auscultate your lungs. Take a deep breath. Good. Again. Good. Again. Good. While we also have you sitting in this front position, before we move to the back and do the respiratory, I'd like to listen to your heart sounds. There's 5 different places we're going to look. We're going to look at the aortic, which is second intercostal space, right of the sternal border. pulmonic, which is also the second intercostal space, but on the left side of the sternal border. Then we're going to go down one intercostal space, go to herbs. Then we're going to go to the tricuspid, which is in the fourth on the left sternal border. Then we're going to look at the point of the maximal impulse, which is going to be the fifth intercostal space, midclavicular line. Good. Good. S1 and S2 are audible, and no signs of any abnormal heartbeats or any murmurs of that sort. So that's good. So now we're going to go ahead and do the posterior respiratory exam. If you could please just face towards the camera for me. Again, we're going to notice the shape, notice the contour, make sure that there's no abnormalities. Everything looks symmetric. We don't notice any abnormalities. I'm going to go ahead and palpate. Don't see anything there. I'm going to go ahead and I'm going to percuss. Noticing for resonance again. Okay. Then we can go ahead and do tactile fremitus on the back side. Say 99.
99.
Yeah.
99.
Again.
99. 99. 99.
Good. All even and symmetric. Now we're going to auscultate. Deep breath. Yeah. Again. Yeah. Yeah. Good. Now that we've done that, we're going to go ahead and we're going to continue with our exam. We're going to move forward. I'm going to have you lay back if you don't mind, so that we can examine your abdomen. As you lay back, you lay flat down for me. We're going to go ahead and check. We'll notice the contour of your abdomen, see if we can notice any masses, any pulsations. Check for one side versus the other. Make sure that everything does kind of look symmetric. Checking the contour as well. Before we go ahead and before we palpate, we're going to auscultate in all four quadrants. Good. Vowel sounds are present in all four quadrants. Next, we're going to go ahead and we're going to start with light palpation. Let me know if any of this bothers you. Then we can move down to a more deeper palpation, feeling for any masses, any lumps on either side or in either quadrant. Now that we've done that, there's one test that we can do. We can go right underneath this costal margin on the right side. It's called the hooking technique. We're looking for a Murphy sign. Take a deep breath for me. Any pain there?
No.
Good. That could let us know if there's any cholecystitis, which is inflammation of the gallbladder, which is not present. Another test that they do is rebound tenderness, in which we do deep palpation. On this right lower quadrant, we let go abruptly, and if there's any pain there, that can show a sign of an inflamed appendix. We can also check for referred pain with the Rovsing sign, in which we put deep palpation on the left side. We let go and you would feel the referred pain. We can also flex the hip and the knee and internally rotate. Again, that's the obturator. That could be a sign. Or checking the psoas muscle. Try to lift your right leg. And if that elicits any pain as well, that could be a sign for appendicitis. Now that we have you laying back and we've assessed your abdomen, another thing that we could have done when we went through too, we could percuss your abdomen. I would go ahead and do that just to listen for the sound to see if there's any abnormalities. A lot of times if we do feel dullness throughout, a lot of times up in the front, when we get to the liver, you could feel that dullness if we palpate up, or sometimes there could be stool in the abdomen in which we feel as we go throughout. But again, everything sounded normal there. Now what I'd like to do is I'd like to go ahead and check your grip strength. Go ahead and squeeze for me. Good. That's even and symmetric on each side. What I would like to do now is go ahead and grab my hands, push away from me, Now pull. Good. Pull your feet back to you. Now push forward. Good. Grip strengths are equal each side there. Your strength is normal. It's 5 out of 5 right there on both of your bilateral lower extremities. While I have you laying here, I'm going to go ahead and check your pulses. I'm going to check your carotid. It's 2+. And I'm going to check this side, making sure that we don't do the carotids at the same time on each side. But they're 2+. I'm going to check your radial. Good. 2+, strong. We can check your femoral. Good. 2+. Now we're going to check your popliteal. Good. 2+. Dorsalis, pedis, and tibialis posterior. Good. All 2+. And I'm looking at the side, I'm feeling there's no edema. Checking cap refill. Making sure it's less than 3 seconds, which it is. And all 4 extremities there. Very good. Now I'd like you to sit up if you don't mind, Ms. Catherine. While we have you sitting up, I'd like to go ahead and check your reflexes. We'll check your triceps reflex. Good. It's 2+, which is normal. Your brachial. Good. Brachial radialis. Good. Patellar. It's 2+. Okay. And your tibial. Good. 2+. And we would do the same thing on the other side to elicit those results as well. While we have you sitting there, we're going to do one thing that we call, it's called graphesthesia. What I'm going to do is I'm going to get you to close your eyes. Pass me your hand, please. I'm going to draw a number in your hand and let me know what number I draw.
8.
Good. There's another test that we can do. It's called stereognosis. I'm going to place an object in your hand with your eyes closed. Go ahead and, what does it feel like?
Coin.
Yes. Good. Very good. Now that we've done that, I'd like you to go ahead and stand up for me if you don't mind. We're going to do a few motor tests with your arms, since we're going to start at the top. What I'd like you to do is stick your arm straight out for me. Good. Go to the front. Can you move your right arm back out? Good. Move your left arm back out. All right. Now you can put your arms down. With your right arm, can you come across your body? Good. With your left arm. Now we're going to do the Apley's test that we call Apley's scratch test. With your right arm, can you move it back behind you there? Good. Do the same with the left. Good. Now we're going to check your trunk. Can you lean to one side? Lean to the other. Good. Can you bend forward? Good. Can you lean back? Good. All right. Now with your legs, I want you to flex your right leg, your hip, and then flex your knee. Okay. Can you internally rotate? Externally rotate? Good. Same thing with the left leg. Internally rotate. Externally rotate. Good. With your right leg, pick your leg up. I want you to, can you rotate your foot? That shows us good eversion. Eversion. Same thing with the other foot. Rotate it. Good. Good inversion. Good eversion. Now that we've done those tests, kind of step forward for me a little bit. We want to see, can you go straight back with your right leg? Good. Shows extension. Same thing with the other leg. Can you show us extension? Good. Now that you're standing there, one other test we want to do for cerebellar dysfunction, I want you to go ahead and close your eyes. Stick your arm straight out in front of you. And we're going to want to check this for 30 seconds to make sure there's no swaying, that there's no falling over, making sure that the cerebellar function is intact. And as you can tell, she is standing there. She's not falling over. She's not swaying. So it's showing that she does have good cerebellar function. Good. Thank you, Ms. Catherine. You can put your arms down. That concludes our assessment. Thank you for being with us.